Hi, my name is Kathleen Harris. I'm an OB provider. I practice maternal fetal medicine, and I've been practicing in Arizona for the past 25 years. I serve on the board of directors of the Arizona Perinatal Trust. The Arizona Perinatal Trust promotes and facilitates quality health care, wellness, and equity for all pregnant people, parents, infants, and families. And they achieve this through programs of voluntary certification for facilities, education, and advocacy. As an effort to address the issue of maternal morbidity and mortality, the Arizona Perinatal Trust has been leading an initiative called the Crucial Voices of Arizona Project. And in this project, listening sessions were held with various groups of women who are at risk for perinatal complications. While members of each group described their unique experiences individually with healthcare during pregnancy, birth, and postpartum, some common themes emerged from these listening sessions. One was that many experienced trauma during their birth experience, and they described instances where perhaps something that was traumatic for themselves was treated as routine by their provider. They described gaps in care or lack of continuity of their OB provider. There was fragmentation of the healthcare system and poor communication from facilities like emergency departments to the OB provider. There were difficult times getting information from the provider about what was happening with their pregnancy and birth, and sometimes difficulty from the hospital obtaining their information from the offices. They commented that they wanted to get more explanation from their providers about the issues that were going on and go beyond just getting a flyer. So they really wanted to have more information be explained to them. And there were common instances of having language barriers, making it difficult for people to understand what was happening to them. And the overarching theme is that they're not feeling heard. They've commented that they should not have to beg to be heard. We need to make changes by providing respectful maternity care and by listening to what our patients are telling us. And we want to always ask ourselves, do I hear her? And we want to take these opportunities for families, communities, healthcare systems, and providers to collaborate together as partners to achieve our goal of reducing maternal morbidity and mortality. To me, respectful care starts with me having an awareness that the way I'm speaking to people in my body language can really make a difference in how a patient perceives our interaction together. We need to try to connect in a meaningful way with someone else who's coming to us asking us to keep them safe. And so I want to make sure that I can sit down on the same level with that person and really show them the regard of being able to listen to what they have to say to me. That means, not having distractions, being pulled away, not having a noisy environment and interruptions. That means making sure they know what my role is. That means addressing them in the way they prefer to be addressed and not assuming how we want to be called. Including a family when they would like that as part of the discussion. When I am going to see patients, I'm going to check myself. I want to make sure, am I fully present, or am I distracted or tired or somehow not fully giving my attention to this person? If a patient ever says they just think there's something wrong, they don't know what it is, that's enough for me. Just even asking the question right away tells me, let's find out more. I want to hear what they have to say. So sometimes I think that's a real source of disconnect for us as providers, and certainly it seems to be a source of disconnect from the way patients think about it. Sometimes it feels hard to find the joy of practicing medicine or being in obstetrics or midwifery because of all the demands. But I think that's exactly what people need to get back to, is getting face-to-face, talking with our OB patients, and getting to know what's happening in their lives. That's what we really all have enjoyed about being an OB, and being able to go through that pregnancy journey with them and then be present at the moment. One of the biggest moments of our patients' lives is giving birth, and we can be a part of that. And that's the privilege that we have in being an OB. So we need to take this feedback and learn from it. People are trying to tell us something about what's been happening in their OB care and that we can do better. So listening to women's stories, and especially when they're bringing concerns to us, where they're having warning sign concerns, we can't be dismissive of that, because that's just as important as knowing all the medical guidelines, as knowing how someone's trying to communicate with us and picking up on that and taking the next step to put it into action so we can keep someone safe. Help her feel heard.